In the Camacho 2024 paper, we saw that Regeneten was able to regenerate and regrow tendon in full thickness tears. But how exactly did this happen? There's an important piece of anatomy in the rotator cuff that we don't often speak about, which is called the rotator cuff cable. This cable is a thicker piece of tissue that runs through the rotator cuff. And the area that attaches the tendon to the bone inside the rotator cuff cable is called the rotator cuff crescent, which is seen in figure B. The rotator cuff cable has two attachment points. The first one is close to the biceps. The second one is closer to the posterior side of the infraspinatus. And it is a very large anatomical structure for the rotator cuff itself. So why do we need this? Dr. Burkhardt was one of the first people that actually identified and spoke about the importance of the rotator cuff cable. He describes it as acting like a suspension bridge that has two large pillars, taking the weight, force, and tension from contractions from the supraspinatus. Another way to think about it is a hammock attaching to a tree. All the force in the hammock is distributed onto the trees where the two pillars are. But what happens when the cable is damaged or torn? When the cable is intact, the forces are equally distributed throughout the whole area of the rotator cuff. When a small tear occurs in the rotator cuff crescent, most of the forces don't actually increase that much because both of the cables are intact and still taking the majority of the forces. These are the types of tears that we see in the Camacho paper. Smaller tears, 2.5 centimeters or less, when the rotator cables are still intact. But what happens when a cable is damaged or torn? This is where the forces are dramatically increased and all the forces shift to the other attachment side of the cable. These types of patients would actually need some sort of anchor repair in order for the tendon to heal. And this is why Dr. Camacho decided to start this paper. He knew if he could treat patients with Regeneten that had an intact rotator cable, had a full thickness tear in the rotator crescent, they would not have that much stress that would allow Regeneten to regrow and regenerate new tendon tissue and achieve the results he did in this paper.